So I spent the morning in our Bethesda clinic and actually got to work with one of our newer clinicians there. And the first person that we saw was an individual who was coming off of a hamstring strain. About 2 weeks out, this was an adult recreational athlete. He actually injured it playing tennis, but tennis is just one of the many things that he's involved in. Likes to run 3 to 5 miles about 3 to 4 days a week, in addition to playing tennis and just some other recreational sports. So one of the coolest things that I got to hear from him was this is a patient that has been in the R2P kind of ecosystem for several years, has been in and out of the office over the last 3 or 4 years just for a variety of different minor aches and pains and injuries. And he's worked with some of our most tenured clinicians on staff. And now he just got done or just started working with one of our newest clinicians on staff. And the coolest thing that he said to me kind of in confidence afterwards was, just give me a heads up that he felt that the sessions have been the same every time he's come in regards to the level of care, the level of attention, and just meeting his expectations as a patient. So that's always comforting to hear when you have somebody that originally worked with one of our first 5 people we've ever hired in the company and is now working with our newest member of the company. This session, one thing that kind of stuck out to me was the amount of bruising that this individual had on the distal part of their hamstring. Highly functional at this time, but did have some bruising present about several days up to a week after the initial injury. The patient didn't even know it was there until our clinician had pointed it out at the time of the eval. But really that brings to light to me that this was a relatively significant hamstring strain. So you do need to be mindful of just your timelines with progressing back into higher level tasks. Make sure we've cleared all impairments, we've had adequate time to build strength before we try to get back to some of our running and higher velocity tasks or change of direction tasks like tennis, which is how he originally injured it in the first place. So with this session, our PT started off on the table, doing some light hands-on work, kind of verbalized that to the patient as a way to give the patient a better awareness as to what and where he's feeling certain sensations, and also let him tease out how much of this is actually behind the knee versus above the knee where it is the distal hamstring. How much of this may just be a little bit of proximal calf irritation as well. That could be just a secondary impairment to the original activity. But more importantly, what I loved that our PT did during this time was he laid out what the rest of the session was going to look like. So he leveraged that manual time to do some soft tissue work, get the patient calmed down a little bit with some of the tone that he had in the hamstring, desensitize that area, but use that 5 to 10 minutes of time to lay out what the next 40 to 45 minutes of his session was going to look like. So when they finished the hands-on work, they stayed on the table, did some light mobility work on the table with regards to active hamstring stretching, did some just quick bridging variations on the table, got things warmed up. Then after that, we got onto our feet and the rest of it looked pretty much like a workout. We got into some different squatting patterns, some different hinging patterns. One thing that I loved was variations in foot width and variations in stance. And I think that the PT did a very good job of finding a variety of different activities to put the hamstring in different lengths with sagittal plane tasks, with frontal plane tasks, and then also mixing in some other transverse plane activities as well by adding in some rotation, maybe not at the hips, but through the trunk with some of our squatting variations. To have this individual go through a lot of the different movements he's going to have to do when he returns to running and return to tennis. But we're able to pick and choose our spots to expose the hamstring to all the different types of stresses that it's going to encounter. The other thing that I think he was appreciative of was in these early phases of rehab, you can only push the intensity so much. So a way to kind of supplement the session, if you're limited with how much you can just progressively load from either a volume, an intensity, or resistance standpoint, what we can do to still add value is maximize the types of exposures that we're giving to that hamstring, meaning isometric versus isotonic exposure with contractions, but then also changes in position and changes in length, and doing that via squatting or hinging patterns and open versus closed chain activities. So the other thing that I thought the PT did very, very well was sequencing these lower level tasks into a circuit where there was minimal rest break and minimal downtime, So we were able to get a good cumulative effect of that entirety of the workload, as opposed to chunking it into 6 different individual tasks that, when done on their own, they may not be all that stressful and all that overwhelming for the patient. So all in all, I thought it was a great session. They hit on some symptom management, they hit on some mobility, they got into some strength work. The strength was a mix of targeted hamstring work, but also just general lower body, almost what you would consider like GPP type activities. And he had expressed to the patient that in another couple weeks, he'd like to start getting into a return to run program that'll look like some form of a walk to jog interval that they'll progressively increase. As they're doing the return to run program, they're going to continue to maximize the strength training. And as the tolerance to running duration increases, then they're going to start to sprinkle in some of their change of direction tasks. So excited to see where that one heads over the next few weeks.